$1.6 billion, that's over 200 billion Kenya shillings. That is the value of the deal that's been signed between the Kenya government and the United States government in the Ministry of Health. And the Cabinet Secretary for Health, Aden Duale, is still here with me. Let's get into that deal now. So let's start off with how and when this deal was developed.
Yes, thank you, Yvonne. You know, when President Trump came to power, one of the executive orders that he signed was the removal of USAID and the whole ecosystem of foreign assistance, whether it is health, education, defense and security. And I think over a period, they were trying to reconfigure what to call it and how to start it. So in September this year, a team came from the US State Department, and all now USAID programs have been transitioned to State Department. In fact, now it's part of State Department. Comes under Secretary Marco Rubio. So they came to Kenya in September. They met me and my team and CS Bandi. We explained to them, we have shown them. The US has been the biggest and the greatest partner in the health sector in our country. Over 7 billion shillings they have given to our country through NGOs and implementing agencies over the years. So the achievements you see in terms of reduction of HIV, malaria, TB, and many others is because of our collaboration with the US, but in a different framework. So when we came, they approached 5 African countries, and we started negotiating. And when we went for UNGA at the bilateral, between Secretary of State and President Ruto, it was agreed that we fast-track it, and we never looked for consultants. And I'm happy today here on TV to say that the men and women I work with in the Ministry of Health, colleagues from the State Law Office, colleagues from Foreign Affairs and National Treasury, a very strong team, we put them together, and we developed that document I have given you officially, which, of course, many late-night meetings to make sure that we take care of our country's interests, as long also take care of our partners' interests. But we agreed ultimately, and it culminated on the 4th of this month, the signing of 2 documents: the Health US-Kenya Health Cooperation Framework and the data sharing document.
And we'll get into those. It would seem that this is sort of taking over from where US aid left. Why these diseases that were picked? Which ones, first of all? Many would have thought it would be the non-communicable diseases, but how did you arrive on which diseases to focus on in this deal?
No, this is first government to government. And this is for the first time to show that government and the leadership of the 2 countries now will work together. For us as a country, it will help us build a more resilient, sustainable healthcare, because this cooperation is for 5 years, up to 2030. After 2030, the Kenya government will take over the whole program. And that's, I think, the elephant in the room, which is very important for the people of Kenya, that by 2030, we have built a more resilient healthcare system.
So what areas?
So we have dealing with the 4 key areas. Number 1 is, first, let me give you a background. These 200 billion Kenya shillings used to go to NGOs, both locally and externally, implementing agencies. We had no control. Government had no visibility. Government had no oversight. They were reporting directly to their donors. They were sharing data with their donors. So now the whole program is G to G, is government to government. So 4 key areas that we're dealing with. The first one is on what we call disease surveillance and emergency response. And all this will come through the Ministry of Health. And that will be done by one of our key institutes, the Kenya National Public Health Institute. And we have agreed a certain portion of the resources will go. It will upscale the capacity all of our laboratories, about 450 laboratories across the country in our counties, about over 500 Kenyan epidemiologists will be trained. We have agreed on something called 717, that within 7 days we must detect any disease outbreak. Within 1 day it must be notified, and within 7 days an action must be taken. So the whole spectrum of disease surveillance and epidemic response, both within our country and regionally, is part of the program we have signed. Today, you know, we have a serious regional epidemic, the Marburg from Ethiopia. We are watching. We have our own local, the cholera, the anthrax, the mpox from DRC. The second one is, and more important, is on HR. In this program of the previous USAID, there are over 28,000 Kenyan healthcare workers, clinicians, community workers working on HIV, on TB. This staff will be transitioned to the Kenya government payroll. So their jobs are secured. And by even 2030, again, they will be officially transitioned to our Kenya government payroll. And why are we investing? This program is giving us a leeway where, for the first time, we will be in charge of our healthcare system. We have strategic programs, the Kenya Healthcare Strategy Program. We have the universal health coverage. For the first time, the 200+ billion shillings will be specifically targeted. Less than 20% will be used for overhead cost. 70% of that money will go to the patients themselves, unlike before where 60% was going to the overheads of the international NGOs and the local NGOs. The third one is community security. From December 2026, KEMSA now will take over all the procurement, the logistics of, or whether you call it ARVs, malaria medicines, and all these. So it will help the capacity in terms of procurement, in terms of logistics, in terms of systems, the commodity security.
Okay. All right, yeah.
Then, of course, there is the digitization and SHA on primary health care. Now, HIV, malaria, TB will be integrated into SHA at the primary care level.
All right. We'll talk about that funding in a moment. But health is a devolved function in the country.
Yes.
To what extent were the counties involved in this deal? Because they're the service providers.
In fact, I told you the county government, the national government, the Ministry of Finance, which is going to sign the financing agreement, the Ministry of Health, the State Law Office, the Foreign Affairs, all these are one government. We are interdependent, we work together. A lot of the activities will be done at the county government.
So how were they included during the negotiation process?
They were with us.
They were with you?
They are with us.
So the county government or the Council of Governors was involved in the negotiation
They are representing
process?
the Secretariat were there with our technical team.
I want to talk about the funding now because this is a conditional grant with Kenya expected to take up 100% of the roles that this fund will provide by 2030. Let's talk about this gradual increase in funding versus the gradual decrease from the US between now and 2030. Talk to us about this budgeting and where this money is going to be found with respect to...
As I'm talking to you, we have a huge budgetary allocations for the health sector, whether you call it the primary health care under the universal health coverage, 23 billion. Emergency, chronic, and critical care, about, I think, 8 to 9 billion shillings. Only those two alone, if you add. And you know, the primary health care increases relatively to the number of Kenyans who register every night. Now we are at 27.8 million Kenyans who are SHA members. So the way it works is that this is a grant, but from the second year, 2026, 2027, we will allocate in our budget 10 billion. Then the next year is 20 billion. The third year is 35 billion. And the fourth year is 50 billion. And this is part of already what is found in our healthcare budget.
Waziri, there have been questions about the emergency, chronic and critical fund and all of these funds that are under, SHA. Yeah. And those have been significantly underfunded in the budgets. So the question that many Kenyans are asking, it's a noble idea for these grants to come into the country and for the Kenyan government to take these up.
Well, it has been underfunded.
How much
the primary health care budget, estimated budget, is 23 billion. In the first budget that the minister read, 13 billion
How much
have been
is
allocated. In the supplementary budget that he's going to give us in January, he will allocate the extra 10 billion.
But that's by supplementary budget, because the question is that with all of these funds...
Even if he gives us 23 billion by July, still will not have exhausted that money.
All right, because funding...
Just like I'll tell you, the amount of money I was given, the Minister of Health was given to absorb the interns or the UHC staff is not 100%, like 70%. That can take us up to February next year. But by January, in the supplementary budget, the minister will complete. Government works in perpetuity.
This is correct.
Yes.
However, the question is, with challenges in funding healthcare in this country that we have experienced, in what ways are you going to be then innovative to say, with everything that the US government is funding now, that this is something that's going to be taken up completely by the year 2030 as we transition out of this deal?
In fact,
I mean, there's many Kenyans who know. And the questions of...
If you interrogate the budget of the Ministry of Health, now even, minus the 210 billion the US are giving us, we had a constitutional and moral duty to make sure that we take care of the health of our citizens. It's a constitutional right, Article, I think, 43, that every government must give its citizens the highest standards of health. So minus this agreement, it was a moral and a constitutional duty for the government of President William Ruto. And that's why we introduced universal health coverage.
Right. But
so now that we have got a boost of 210 billion, our counter funding, and we do a lot of counter funding with Gavi, with Global Fund, you know, in terms of vaccinations.
Yeah.
And we are committed, and we ring fence. So the 10 billion, the 20 billion, the 30 billion, the 50 billion that will make us self-sufficient by the year 2030. The Kenya government, in fact, is giving the Ministry of Health more.
So my question is, with respect to that, even things like the Emergency, Chronic and Critical Illness Fund, for instance, under SHA, is chronically, under-budgeted or under-allocated with severe budget cuts and implementation under this. So my question is, there has been a struggle with funding healthcare, particularly those three funds under SHA. What commitment is there, and where are you going to get these extra resources? Because in this deal, the Kenya government is then committing itself to taking over the many functions that will be funded by this deal. So what happens as we go progressively forward if we're already having challenges?
Now, this is where we are not getting it. This deal is part of what we are doing, what we are budgeting for, what we are allocating for.
And once it is done,
it is reinforcing
because it ends in 5 years.
It is reinforcing it. And that's why we have agreed, if we put the 10 billion, if we put the 20 billion, we put the 35 billion, and we put the 50 billion, and we work with the 210 billion that we're getting from the US, by 2030, without any fear of contradiction, the Kenya healthcare system will be resilient, will be sustainable, and you will see it. Secondly, the emergency critical and chronic fund. In fact, 80% of the money still we have not used it because it has two functions. One key function we are launching now, the emergency ambulance system. It's now that people are embedding the ambulance system where any Kenyan, anywhere, when he gets sick, an emergency, he will just call a toll number. An ambulance, the nearby ambulance, will be sent to that person from the command center. The ambulance will be paid by SHA, and then it takes that person to the nearby health facility. And the first 24 hours, SHA, whether he's registered with SHA or not, SHA will pay. So after 24 hours is when now his payment will kick in. So emergency, chronic, and critical fund. The only bit now we have used, which is the SSY, it has been brought as a fund, is that in the event Kenyans who suffer chronic diseases like cancer, in the event they exhaust their cover, then they transit
to that fund. But you've said that funding and government works in perpetuity, and that you work with donors like Gavi and others.
Yes.
In the funding of that.
Yes.
Okay. But there is...
In fact, the US is the largest donor of Global Fund, about 30%, and a big donor to Gavi.
Yeah.
And what we have done now, since I came to office, and with the help of my brother, the CS for National Treasury, we have made sure that certain budgetary allocations, which are very critical to the people, like vaccinations, that has been ring-fenced, that will not be ever again be subjected to the vagrants of supplementary. Okay, and
Gavi with vaccines, those are classified as health commodities, right?
Yes.
Okay, but in this agreement, Section 2338, speaking of funding for health commodities, the agreement says that funding by GOK is expected to only include funds directly by GOK and is expected to not include grant funding from other donors or multilateral organizations. So does this agreement then lock you out from seeking funding for health commodities from any other entity other than the United States government?
No. Global Fund and Gavi, their funding and the kind of commodities they give us are fundamentally different from what this deal mainly focuses on. In terms of commodity, it focuses on HIV, on TB, and on malaria. Gavi and Global Fund focuses on a different ecosystem.
But should the government find any other donor or multilateral organization you want to work with respect to the health commodities under this deal?
Not on this deal.
They are locked out of this deal?
No, not on this deal. We have them. This deal is a counterfunding. It's between us and the US.
Okay.
And our part of the bargain is our counterfunding, which is on the side of the Americans declining, on our side progressing. But any other donor, we have a very strong called the Health Donor Group who support us. But let me pick on the digitization, for example.
Yeah, no, we'll get to digitization.
I'm just saying.
Because I want us to go step by step.
Yes, the many donors we had, Yvonne, because they were not at the visibility of government, there was no oversight, it was just their own. They had their own systems. They could do a system, they could collect data. We have no control over those data. And now in the Ministry of Health, all the 20+ systems, mainly funded by donors, now we have transitioned them to the Digital Health Agency. So right now we have one-stop data hub in our country. If you want to find if the doctor is registered, is qualified, KMPDC. DHA has 38 systems.
All right, Waziri, I don't want to lose that point, but
yes.
we will come to it.
Yes.
I want us to move systematically
yes.
with this agreement
yes.
so that we can get everybody to understand step by step. So just my understanding is that this agreement locks the Kenyan government from seeking any other funding from any other donor organization for the duration of this deal.
No.
Of this agreement.
No.
It says here,
no.
Funding for health commodities that it'll only include funds directly by GOK. I'm just asking, just so that we understand.
No.
And it says that it is expected to not include grant funding from other donors or multilateral organizations. Yes.
In this agreement, in the 4 sectors we're working with the US, okay, under the 210 billion, this is between Kenya and the US, okay? WHO, for example, let me tell you, which again, the US is not a member. Okay, one of the organizations is not a member. It's one of our key partners. We do a lot with disease surveillance, but not under this framework. We will deal with them in a different framework. So all the other donors who work in our counties will still work, but on this particular framework, on the 4 items we have picked, if a donor wants to come and inject resources, that it will be a different, and let me say it, even the donors you're talking about is where the US ran away from. In all those donors, they don't bring their resources to our budget. They do it off budget. But this 210 billion is part of your budget. It's in our budget. Okay. It's in our plan. We are the ones to execute it. We are the ones, together with our US partners, to monitor, to evaluate. But all the other donors are at the place where USAID used to be. USAID? USAID, yes. USAID used to be. So they can come and support us, but this one is government. But not in this one? Not in this one. Not with any of the commodities or any of the 4 areas. Because this one is government to government. Understood. Theirs is not government to government. So on areas of surveillance of disease outbreaks and epidemics, particularly if there was any work that was being done by WHO, that ceases specifically? It doesn't. It doesn't. Let's take it doesn't, because their resources don't come to us. Okay. Yes. Let's take a break. We come back. We talk about the big elephant in the room, which is the issue of data that many Kenyans have raised, including a number of other, a number of other administrators. And there are people now, the ones who are saying, when I was in Washington, there were people who were saying, Kenyans' data is being sold. Last night when I posted this data agreement on my Twitter and in many places, the same people were saying, no, he has edited. Now, I want to ask them tonight to tell us which area I have edited and which section has been edited. All right, we'll come back and they can answer that question. I need to take a break. Why I came here. I know why you came here, and you will answer the questions. Waziri, please allow me, because this is part of my job that we have to do here. We have to take a break. All of that will be said after the break. It's also my job as the Minister for Health. Let's take a break. Tell the Kenyan. You will have that opportunity after this break. Thank you. Let's take a break. Thank you. Coming up, Health CS Aden Duale breaks down the new Kenya-US health partnership.